Hello everyone, it's so great to see you again. This week we're talking about transferable skills that I learned while being a bedside nurse. Last week we covered why I left bedside nursing, so I thought it was really important to come back and touch on transferable skills that I use every single day that I couldn't have learned really anywhere except by being a bedside nurse. I'm Dr. Lisa Chappell. I'm a Doctor of Nursing Practice, an associate professor, and studying to have my board certification as a health and wellness nurse coach. I make videos for nurses, students, and caregivers on accessing your inner resources to become more empowered and resilient. Speaking of resources, one of them is to reflect upon valuable skills that you gain from doing something in your life that was transformative, and bedside nursing was one of those experiences for me. Some skills that I learned from being a bedside nurse include communication, collaboration, empathy, how to manage my time like a boss, how to complete tasks in a limited time frame, having accountability to a team, the power of presence and showing up, how to have fun in intense situations, how to wash the day off at the end of the day, how to reflect, and that it's the little things that matter. All right, so let's get into what each of these skills has meant for me. Communication. A nurse communicates with so many people while working at the bedside. This includes from the time they show up to get shift report from the previous shift and putting that information together then to deliver to the people that you're working with. Certified nursing assistants or maybe techs who manage care for the patient throughout the day. This also might include a handoff report if patients are going for tests or procedures that day. It includes physicians when they come for rounds, or mid-level practitioners like nurse practitioners and physician assistants. A care team including dietitians, a chaplain maybe if their spiritual needs, pull them into the equation. Pharmacists as you're coordinating for medication distribution. So many therapists, respiratory therapists, physical therapists, occupational therapists, maybe nutritionists. It includes family members as they come throughout the day. So communication with a variety of people in a variety of situations is one skill that I really picked up from bedside nursing. I learned some communication tools as well, some advocacy inquiry tools, and being curious and honest about certain situations for providing feedback. I learned motivational interviewing skills and how to motivate my patients when they're not feeling very well, and to figure out what are their goals and how can I help them with those goals. And so these communication skills are invaluable and I use them every single day. The next skill, collaboration. So not only learning to play well with others, but also learning to work together towards a common goal and figuring out what that goal is, what that overall mission is, and then working together to achieve that. And hopefully at whatever organization you work for, that will be patient and family centered. The patient, their goals, and getting them to a state of wellness where they can move beyond a hospital setting. I learned empathy, how to be with someone in a vulnerable moment and to care and to really convey that caring in the moment, to listen, to make eye contact, to really hear what's being said, and even understand some of the hidden and underlying meaning in those messages in order to reflect it back to help someone move forward from that vulnerable state in their life. I learned how to manage my time like a boss. I had so many tasks that I needed to accomplish within a shift. These included prepping patients for procedures or tests, procedures that I needed to do, like change out a catheter, change an IV line, change out a dressing, change out tubing or IV equipment, checking all the equipment, making sure it's functioning, administering medications, doing wound care, managing IVs, managing G-tubes. All of these things needed to be coordinated along with all of the communication and collaboration, education, planning for discharge, which begins at admission. All of this had to be accomplished within a limited time frame to really prioritize what's most important, to check those items off my checklist, but also be present throughout the day and listen and be empathetic, and then coordinate and communicate with all of the various parties that I needed to throughout my shift. If I could do that during an 8-hour shift or a 12-hour shift while I was a bedside nurse, certainly I can manage my time at home where I'm not in life or death situations. So if you're a nurse, I would love to hear about what are some skills that you've learned from being a bedside nurse. Comment below, I would like to hear about it. I learned how to be accountable to a team. Not only was I accountable to my patients, but I was also accountable to the organization and representing them and providing quality services. Also, let's say there's a big snowstorm or something like that. I was accountable to the organization and to the patients to show up for work the best I can. And that might even involve, if the next shift can't get there because there's a big snowstorm, that I might need to stay the night. And so it was really a deeper sense of accountability than I'd ever experienced before to a team of people. In being a bedside nurse, I learned the power of presence and showing up. If I set my alarm and wake up at the crack of dawn, get myself in the car, get myself to shift report, 90% was done, because 90% of life really is just showing up. And I realized how important it is that I am just there. I also learned how to be present, to live in the present moment. There are lung sounds to listen to, and to just close your eyes and be able to listen to someone's heartbeat, to listen to their lungs, puts you in the present moment. You are taking in the sights and the sound in that present moment, which really draws you out of yourself and helps you to just be. I also really learned how to have fun in intense situations. And there was always intensity that was going on, whether it was emotional or mental intensity, or it's just the nature of being busy. I learned how to engage my other team of nurses, and we would really have a lot of fun throughout the day and have a very positive attitude and bring with us this spirit of fun, despite whatever intensity may be happening. Find moments for laughter and find moments for joy, find moments of gratitude throughout my day. And I learned that from being a bedside nurse. I also learned how to wash the day off. When you come home from a busy shift of bedside nursing, the first thing you want to do is go straight for the shower to literally wash the day off. You need to wash off any germs you may have come into contact with. You don't want to be bringing other infections home to your family. Everybody gets used to that. At the end of your day, you're leaving your work shoes in the garage, you're coming straight in the house, putting your scrubs in the wash, and then you're going straight for the shower to wash the day off. And that's a wonderful routine that I could actually integrate more into my life today, to be able to have those moments to just wash the day off at the end of the day. Whatever blunders you may have had throughout the day, to just let them go, start a new fresh day the next day. Another thing I really learned is how to deeply reflect throughout the day, and being present through a day and looking into people's eyes and hearing their stories and hearing what they have to say. I needed to be able to reflect on those experiences and make meaning out of them, to be able to better understand the human experience, especially during times of vulnerability, to understand what I could learn and gain from those situations, how I could become a better nurse, which I would normally do that in the car on my way home, and process it and make some meaning from it. Finally, a transferable skill that I learned is to recognize that it's the little things that matter. It doesn't matter sometimes what an amazing or wonderful intellectual, scientific care provider you are. Sometimes it's just giving a sip of water, or bringing a washcloth, or bringing a warm blanket, or remembering that someone said that they like their coffee with cream. It's those little things that make the biggest difference, that it's those little moments of kindness or caring where you can have a connection with another human being by looking them in the eyes, by seeing them for who they are, recognizing their strengths. These are the little things that will make the biggest difference. I hope that you're enjoying getting together and just having these chats about what is special in nursing and what makes us the best nurses that we can be and the best people that we can be, and how can we maximize what we learn in our profession, and how can we implement those skills into our daily lives. Thank you so much for being with me today. Please like and subscribe.